Brian, do I have your permission to use you as a case study for my kinesiology 6302 course?
Yes.
And do I have your permission to record a series of assessments for that course?
Yes.
Thank you. All right, so for the first assessment that we're going to do, it's called an active straight leg raise. And for this assessment, I'm going to place this dowel midway between your ASIS and knee joint center. And starting on your good side, if you could go ahead and slowly raise your leg up toward the ceiling. Great, and back down. Let's do 2 more times, please. Great, and this is now the left side where he has a suspected hamstring injury. We're gonna go ahead and do the same thing. And just make sure my dowel is in the appropriate spot and go ahead and raise now the left leg. Again. And one more time. Great, thank you, Brian. All right, so for our next assessment, we're gonna do a same thing, but now passively, where I'm gonna go ahead and raise your leg, and I'm gonna start on the right side, the sound side, and I'm gonna put some pressure here, and I'm just gonna raise you up. And let me know if you feel any pain or discomfort. I'm gonna do one more time. All right, and then I'm going to come around to the other side, and now we're going to do the affected side. And we're going to do the same thing. I'm going to apply a little pressure here, and I'm going to raise your leg, stretch you passively. Down. And one more time. Great, and I'm going to come back to the other side. All right, so for our next assessment, it's called supine knee to chest. And if you could go ahead and bend both legs, bring them to your chest, and then yes, hands behind, and just pull that to your chest. And if you could go ahead and relax and do that one more time. Great, thank you, Brian. And those were our last assessments from this position. Now if you could go ahead and roll over and lie in a prone position or face down. Feet off the edge of the table, thank you. This first assessment we're gonna do in this position is gonna be a hip extension movement pattern. And we'll go ahead and start on with the left leg since I'm on this side. And I want you to go ahead and stay as relaxed as you can with your upper body and raise your left leg, bringing your leg up to the ceiling, trying to keep your leg straight. And I'm gonna go ahead and feel while you're holding it, which muscles you're activating. Go ahead and go again. All right, and one more time. Great, thank you. And now I'm gonna go around to the other side and we're gonna do the same thing. All right, go ahead, Brian. Okay, go again. And one more time. Great, thank you. Now for the last assessments for this, we're gonna go ahead and we're gonna do a manual muscle test where I'm gonna look to your strength and trying to isolate your bicep femoris and then the semitendinosus, semimembranosus. So for the bicep femoris, we're actually gonna wanna externally rotate your knees. Yeah, so just like you're doing, it's gonna be heels together. Now if you could go ahead and bend your leg. I'm gonna externally rotate you a little more. And I'm gonna just apply pressure here. And I want you to match my resistance. And relax. And one more time. Great, and this is the affected side, the left side. And go ahead and relax. Actually, sorry, I'm gonna, from this relaxed position, you can go now heels out. I wanna internally rotate and go up, so toes pointing toward the midline. And we're gonna do the same thing. And now we're looking at semitendinosus, semimembranosus. Relax. And one more time. Great, and now I'm gonna switch to the other side. We're gonna do the same thing. So let's go heels together, external rotation, raise your leg up, externally rotated, applying pressure on your hip and pushing down. And relax. And let me do it one more time. Good. And then relax your leg for a second. Now we're going to do internal rotation. Good. And then leg up again. We're just going to do this twice. One. And one more time. Great. Thank you. So those are the assessments I would use in this case study.